This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, May 12th, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Access to Medications for Opioid Use Disorder Among Veterans with Homeless Experience in Permanent Supportive Housing. This cohort study assessed 10,000 U.S. veterans with homeless experience and OUD residing in permanent supportive housing, or PSH, with respect to factors associated with receipt of MOUD. Only 17% received MOUD within 12 months. Greater behavioral health engagement was associated with MOUD receipt, while older age, race minority status, and prior inpatient hospitalization were associated with lower odds. These results suggest MOUD access in supportive housing should be expanding, which could require embedding addiction care into PSH teams, leveraging behavioral health touchpoints, and addressing persistent disparities. Next is an article in the Harm Reduction Journal and is titled Transitions from First Drug Use to Illicit Opioid and Injection Drug Use in a Multi-Site Rural U.S. Cohort of People Who Use Drugs. Researchers conducted qualitative research to better understand transitions from initial drug use, non-prescribed opioid use, and injection drug use in rural areas. First exposure to drugs often occurred in childhood in the household environment, with the most common initial drug use being marijuana. A combination of drug availability, normalization of use, and use as a means of coping were common themes for initial use. Initial opioid use was most commonly pill form and was commonly prescribed. Transition to illicit opioid use was often related to regulations and decreased access to prescribed opioids. The most common substances first injected were methamphetamines, opioid pills, and heroin. The study highlights the need for early intervention strategies and increased access to mental health care, particularly in rural areas. Our next article is in Annals of Internal Medicine and is titled Initiation of Medications for Alcohol Use Disorder Among Hospitalized Veterans, a retrospective cohort study. This retrospective cohort study of veterans hospitalized with a primary diagnosis of AUD in 2022 or 2023 sought to describe patterns and factors associated with hospital initiation of MAUDs. Patients had MAUD initiated as an inpatient or within 7 days of discharge. Within the Veterans Health Administration, 30% of hospitalizations for AUD resulted in MAUD initiation as an inpatient or within 7 days of discharge, with substantial variation across hospitals and patient demographic and clinical factors. These data indicate a need to identify and disseminate successful hospital-based strategies to increase prescribing of MAUD. Our next article is in General Hospital Psychiatry and is titled Evaluating the Potential Risk of Ketamine-Induced Hepatotoxicity in the Treatment of Mood and Anxiety Disorders, a Systematic Review. Ketamine hepatotoxicity and cases of liver failure requiring transplantation have been reported with the high cumulative doses seen in chronic therapy or recreational use. The degree of risk associated with the lower doses used in treatment of psychiatric disorders is unclear. The systematic review identified 13 studies, including 5 RCTs, of ketamine use for psychiatric disorders and liver outcomes. The RCTs totaled 879 cases, 75 of which had elevated liver enzymes, mostly mild. In all the detailed case reports, enzymes normalized after discontinuing ketamine. Impairment of liver function was much less common. The authors conclude that the low doses of ketamine used for psychiatric disorders can produce liver enzyme elevation, but significant liver injury is rare. However, they advise liver monitoring during ketamine therapy. Next is an article in JAMA Network Open and is titled Impact of Cannabis Edibles Combined with Alcohol on Driving, Field Sobriety Performance and Subjective Effects, a within-participant crossover trial. This within-participant double-blind, double-dummy crossover study sought to evaluate the individual and interactive effects of cannabis edibles and alcohol on simulated driving and impairment measures. A total of 25 healthy adults with a history of recent binge drinking and prior cannabis and alcohol co-use were given either placebo, alcohol alone, or cannabis and alcohol combined. Driving impairment from alcohol alone at 0.08% breath alcohol concentration, or BRAC, was similar to that of 0.05 BRAC and 10 mg THC, highlighting increased impairment at lower BRAC for individuals who also used cannabis. Cannabis alone at a dose of 25 mg THC resulted in similar driving impairment to 0.08% BRAC. However, impairment was not reliably picked up on a standardized field sobriety test for those who use cannabis alone. Our next article is in Drug and Alcohol Dependence and is titled Frequent Police Contact and Non-Fatal Overdose Among People Who Use Drugs in Rural Appalachia. This study examined how police stop and search was associated with non-fatal overdose among people who use drugs in Kentucky. A total of 774 people who use drugs were enrolled in the social networks of Appalachian people and the Kentucky Outreach Service Kiosk studies from May 2023 to April 2024. The study population was 99% non-Hispanic white, 52% female, and 45% with both opioid and methamphetamine use. Of the study participants, 37% reported being stopped and searched, and 17% reported a non-fatal overdose during the study period. Individuals who were stopped and searched by police at least 4 times in the last 6 months had an increased likelihood of non-fatal overdose. Next is an article in Addiction Science and Clinical Practice and is titled Microcosting the Optimization of PREP Implementation Among Sexual and Gender Minority Individuals with a Substance Use Disorder. While PREP is highly effective in preventing HIV, approximately 40,000 new diagnoses occur annually with gender and sexual minorities with SUD at much greater risk. Researchers assess the cost of implementing interventions to increase PREP uptake in this population. The interventions including Assistance Services Knowledge PREP or ASK PREP to assist with the PREP uptake ± contingency management to address SUD. The ASK PREP intervention provides client-centered PREP navigation support and weekly text messaging support. Initial implementation cost was $125,000 for the first year, with a sustainment cost of $99,000 annually at $1,000 per client. The study provides insight into potential resources needed to implement this promising intervention. Our final article is in the New England Journal of Medicine and is titled GLP-1 Receptor Agonists and Eating Disorders, Cause for Concern. This perspective piece notes that GLP-1 drugs have become lifestyle drugs used to achieve slimness by people without FDA-approved indications. In 2018, 4.5% of GLP-1 prescriptions were for people without type 2 diabetes or excessive weight, increasing to 17% in 2023. In addition, some online vendors supply GLP-1 with little meaningful medical oversight. The authors raise concern that GLP-1 drugs could exacerbate restrictive eating disorders such as anorexia nervosa. Anorexia nervosa has a lifetime prevalence of 6.3% in women and carries a mortality risk 5 times that of the general population. With an estimated 33 million people in the U.S. taking GLP-1 drugs, there is the potential for a dramatic increase in anorexia nervosa. The author advises eating disorder screening before prescribing GLP-1s and monitoring for disordered eating during treatment. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.